That's a great question. I think what I've seen immediately is because there has been limited access for the population to like as simple as a primary care doc, let alone specialists. So obviously when we set up the hospital and opened it, people came to our emergency department, right? As almost in any place that people don't feel that they have care or that they have a doctor. So we said, okay, we know people are going to come to our ED. In fact, we see about 80,000 visits per year, annualized. Last year we saw 72,000. We're looking at 80,000 this year, and not all of them are in great need or great, with severe conditions. A lot of them could have just gone to their primary care doc. But what we did with the technology was we said, okay, you're coming in here. Not only do we have an electronic health record system that captures all your needs and documents it, but we're able to share that with other players. So we are in a public-private partnership with the County of Los Angeles, and we see them through our ED. Now we're able to send that information to our county partners that can see this population that has predominantly gone to the county for care. But more importantly, we built the entire infrastructure around high-density wireless systems so that we can incorporate telehealth. And what we use telehealth is for call coverage, to bring in doctors that don't have practice in our area, that perhaps are hesitant to even start a practice in the neighborhood, but we can reach out to where they live and where they have practice and use tools as simple as video-enabled conferencing to bring the doctor here to see the patient, and to have our doctors, our ED doctors, consult with all these physicians and all these specialties. So that was out of almost sheer necessity. We had to build for infrastructure related to telehealth. We had to start with telehealth. And it's really kind of novel in some sense because you think telehealth is really for rural communities, for hospitals in a rural area. We're right there just 10 minutes south of downtown Los Angeles. And we're in this almost professional desert. So we had to use telehealth to reach out, to have doctors work with our patients, to have these doctors that are in Beverly Hills, West Side, Hollywood, downtown LA, to remote call in and be part of the patient care. But I think what I'm really excited to tell you is that the technology also attracted a lot of the people that wanted to do something great and something innovative. So by creating an institution with technology, high technology as a baseline, such as we have iPhones for every doctor, nurse, environmental services, transport, security. They all have a mobile device. We have iPads throughout the hospital. So doctors know that we're here to really kind of push that barrier of providing that high quality care in an efficient way, in a fast way. So they came from other institutions that are still trying to implement these technologies, and they're having a challenge because healthcare is so slow to change, especially in a hospital setting, that they came to us and said, we want to try this new high-tech hospital. We want to participate in providing that high-tech care. So technology worked in both getting access to care and also helped in attracting staff that wanted to be a part of a great team. I think we had an advantage. As a startup hospital organization, we were able to kind of set the bar so people would come in and say, okay, we've got all this technology, we've kind of designed all these workflows, but we're brand new. Let's put it into practice. So when we opened, I think one of the challenges and barriers we had to overcome to lead to our success was that when patients started to come to the hospital, we had to adjust the workflow to utilize and take advantage of the technology. But also we had to adjust the technology to really support the right workflow for the nurse and the physician. And what I mean by workflow is just as simple as a patient coming into our ED, us registering that patient, doing an evaluation, triaging them through our system, providing that care in a timely fashion, getting those orders in, prescriptions in, and then more importantly, we invested heavily in a care management model. So we hired close to 70 care managers and care coordinators that take responsibility for every patient that comes into our hospital. In fact, we were the first, for a while, we were the only hospital in the state of California that had a care manager for every single patient, regardless of their condition. So I think what made us successful was that we were willing to adapt and change quickly. We weren't set in our ways. There was no historical history. All the staff was new. I was employee number 2. All the doctors and nurses we hired in a 9-month period, almost 700 people were hired in a 9-month period, over 1,000 now in a 14, 15-month period. So I think everyone didn't have an old history. Like, this is how we've been doing it for a long time. We had to overcome some other bias of, well, this is what we did at the other hospital, which is fine if that was a best practice. If that was something that worked there, that you wanted to bring to make something that wasn't working here, great. So I think for us, and this is part of my presentation tomorrow, that you could have all the best technology, but if you don't focus on the people and the fact that they're the ones using the technology to deliver care, that the technology is there to be a support, not to supplant the priority of how you provide care. What I would tell other CIOs is, and I think they know it inherently, it's not, I'm not on a particular soapbox, but it's not always about the technology. It's about people and process leveraging the tools around them, and it can include technology. I think more and more I'm thinking that one of the greatest tools we have isn't technology, it's culture.